It started in Sydney's east, spread to the city's west, and now the virus is circling back. 3 more local government areas have been added to the list of hotspots. COVID has taken 2 more lives, men in their 90s. Another 345 people have the virus. Only a third of them are confirmed to have been in isolation while infectious. Coronavirus is reaching further into regional areas too, and the Hunter lockdown has been extended. We'll have more on that soon. First to Cayman Gock in Strathfield in Sydney's inner west. Cayman, more residents now living under tighter restrictions.
Jeremy, the rules came into force late this afternoon across Strathfield, Burwood and Bayside. If you live in these council areas, you cannot travel more than 5 kilometres for shopping and exercise. The only people who are allowed to leave are authorised workers and right now do not require surveillance testing. But whenever you do decide to leave the house, whether it's to go outdoors or in, at all times you must wear a mask. Hassan Ayash's dream of opening a Lebanese bakehouse was delayed by last year's lockdown. After just months of starting, he and his staff are being squeezed by even tighter restrictions.
It's tough. It's very tough. Look, my workers understand if there's no work, there's no work.
There's some of 270,000 Sydney-siders in the Bayside, Burwood and Strathfield council areas. All up, there are now a dozen hotspots, home to 2.5 million people.
Mate, it's getting ridiculous.
Nothing surprising anymore with COVID, so...
But the Bayside Mayor says only some suburbs should be locked down harder.
I'll definitely be following up and I'll definitely object to the fact that 3 suburbs are locking a whole city.
In some communities there's definite boundaries where people don't tend to go beyond, but in other communities they're so interconnected that it's really difficult to control the virus unless you incorporate a bit more.
More than 80% of today's infections have been found in the areas of concern. There are 4 cases in both Bayside and Strathfield and 2 in Burwood.
I'm happy to lock down here because it's very bad.
It was to be expected, let's be honest. The cases aren't getting any better.
Another 2 men have died. Both were in their 90s. One was a patient at Liverpool Hospital, taking the toll of that outbreak to 7. The other was a resident of the Wyoming aged care home in Summerhill. He'd had 2 Pfizer doses.
We can understand that people in their 90s are frail and vulnerable.
While police have asked the Defence Force for more help, you could also see extra troops at places like this. The Premier wants the ADF to join the vaccination campaign.
It might involve them setting up an additional hub using their logistical expertise.
More jabs are already going into arms, helped by overnight clinics like this one at the Sydney markets. Testing records are also tumbling. More than 150,000 swabs have been taken, but some people are waiting days for their results.
I want to assure everybody that the public health team notifies positive cases as a priority.
They've made more than 2,100 of those calls in just the last week. A third of cases were children and teenagers. Cayman Gock, ABC News, Sydney.
Health services in the remote community of Walgett are not sufficiently prepared for a COVID outbreak. That was the frank admission from the Health Minister today after news of a confirmed case in the Walgett Shire. The region is now in lockdown along with 8 other local government areas.
For this remote community in northwest New South Wales, the reality of a pandemic has hit hard and fast.
COVID was a big deal still, but we weren't really touched by it. And I guess no one expected it to come out this far.
And for health officials, the gravity of the situation is clear.
I expect we will see additional cases in the next 24 hours, and they could grow significantly.
Along with the man in Walgett, there are 3 new cases in Dubbo, bringing the total in the state's west to 6.
Are you confident that there are enough resources on the ground in health services in Western New South Wales if there's an outbreak in Walgett and in those areas?
No, I'm not, and I make that very clear.
Perhaps the biggest worry is low vaccination rates in a group that was meant to be prioritised for early access.
By far the majority of Aboriginal people in that northwestern section of our state have not received the vaccine.
Thousands of Pfizer doses are being dispatched to Walgett, but the federal opposition says it's come far too late.
How can you have ignored the potential disastrous situation that is emerging in the Western Division?
In Dubbo, businesses are adapting to lockdown as best they can.
The general sense is most people are worried and talking about what's going to be happening in town and what the numbers are going to be tomorrow.
In addition to Dubbo, the lockdown now takes in the local government areas of Narromine, Gilgandra, Warren, Coonamble, Bogan, Walgett, Brewarrina and Burke. There's now a sudden sense of urgency about the need for more vaccines in Walgett. Ramping up the rollout will prove to be a major challenge for this isolated community, which now finds itself at the front line of a battle to keep COVID-19 at bay. From 9 a.m. tomorrow, people can get a Pfizer jab at the Walgett RSL Hall.
I would encourage community members within the LGA to come forward and receive that vaccine.
It won't come soon enough. Gary John Lysart, ABC News, Walgett.
Aboriginal people in the states west are particularly vulnerable in this pandemic. Indigenous communities reporter Nakari Thorpe explains some of the key risks they face.
A third of Western New South Wales is home to some of the most disadvantaged people in the country. There are more single-parent families, lower rates of education, and welfare dependency is high among young people. Almost half of the communities are remote or very remote, so being able to see a doctor and go to hospital is a top concern. The region also has a large Indigenous population. Almost 13% identify as Aboriginal. It's much higher than the national Indigenous population. But they live significantly shorter lives. The average age of an Indigenous woman is 74.6 years, compared to 83.1 for a non-Indigenous woman. The gap is slightly worse for men at 70.5 years, compared to 79.8 years. And with more than half live with multiple chronic health conditions like diabetes, cardiovascular disease and kidney disease. In the state's northwest, only 8% of Indigenous people are vaccinated. So if an outbreak does occur there, it could be devastating.
There is some positive news for regional New South Wales. No new cases have been found in Tamworth, Armidale and Byron. But the lockdown in Newcastle and the Hunter region is being extended for another week as infections there keep climbing.
Beautiful weather to be out and about, but the lockdown will remain.
I think given what the area is experiencing, the community would understand why that's the case.
Cases in the region jumped from 14 yesterday to 24 today. 6 people were infectious while in the community.
It's just crazy how such a small event can impact so many lives.
The way it's been handled to this point is a little bit wishy-washy.
Health authorities say a 21-year-old woman's 5-day holiday is to blame. The Western Sydney resident caught a train to Newcastle in late July and attended parties at Shortland and Blacksmiths Beach. From there, exposure sites have ballooned across the region, with total cases now hitting 77. Police fined her and another woman $1,000, but the pair continued to defy orders to return to Sydney for several days.
I did joke with our medical controller about 4 weeks ago that we should have gone down and blown up the Hawkesbury River Bridge, and I'm actually regretting that we didn't at the time.
Today, 40 workers at Tomago Aluminium went into isolation after a visit from an infected Sydney construction worker. And cases are growing at the Masonic Village Aged Care Home, where 11 residents and now 3 staff members have tested positive.
It's a very nervous time. I'm concerned first and foremost for the residents, very closely followed by their families. I would hate to have this as a family member.
Only 38% of workers at the site are vaccinated, with poor access to the jab being blamed.
All of the infected residents are in hospital. 3 of them are on oxygen and only 1 isn't vaccinated. But there are fears the cluster will grow.
Across the Hunter, everyone is hoping one more week of lockdown will be enough to stop the spread. Ben Millington, ABC News, Newcastle.
Let's take a look at the latest vaccination rates. In New South Wales, more than 105,000 vaccines were administered today. A quarter of the state's population aged over 16 is now fully vaccinated. But some hotspot areas in Sydney are tracking below the state average. Across the country today, more than 250,000 doses were given.